Thank you, everybody, for joining us today, and good afternoon. My name's Hadley. I run marketing at Perks Health, and we're joined today by Karli Edgerton, who is a health and safety and wellbeing manager with over 15 years of experience. Very excited to have her join us. And we're going to talk about how we can improve return to work outcomes, both for the injured person and for the company by bringing a little bit of humanity back to those conversations and to culture. Karli is very well placed to lead this conversation. She has, I said, over 15 years of experience across workers' comp, injury management, workplace health and safety. I've heard her speak before, and she tells a very good, she has lots of experience and she tells good stories, which I think are really illuminating when you're trying to both understand what doesn't work, what's gone wrong, and what you can do better. Um, so without further ado, I'd love to hand over to Karli. She's going to talk about the problems we see with burnout, with overworked staff, and how fear can override good intentions and what we can do about it. So Karli, over to you.
Thanks so much, Hadley. Really appreciate you having me, and welcome to everyone who's made some time to join in today to listen to hopefully some things that you've probably heard before, but hopefully there's some new takeaways that you'll get some value out of too, and you might be able to implement going forward to make your life easier, and to make our injured team members' lives easier too. So a little bit about my background. As Hadley has said, I've worked in the health and safety industry, I guess you would say, or profession for about the last 15 years. I've naturally always sort of combined safety with workers' comp or injury management, which is not necessarily a natural progression, but I've really always been fascinated about obviously preventing things and trying to put corrective actions in place before an incident or injury occurs. But I think that I'm also quite pragmatic in that I understand that unfortunately these things do happen. And I think we'd all know that we see injured workers and ill workers. Those rates are are increasing across all of our jurisdictions at the moment. So for me, it's just as important, the prevention is there, but we need to focus on what do we do when things do go wrong? How do we respond? And what are some really key sort of takeaways that we can easily implement to get some really measurable outcomes that, as I said, make your life easier, and they also help our team members. So thanks again for joining us. I'm going to go through a little bit of a PowerPoint deck today, but again, I don't want it to be sort of a death by PowerPoint. So we've got the chat button open. Any questions you have at any time, please pop them in. Hadley's going to be looking at them as we go as well. And I'm very happy to answer anything that you might have, a specific sort of request for or whatnot as we go. Just pop them in there and we'll answer them and get started. So I'm just going to pop up the slide deck now.
Whilst Karli's doing that, yes. Well, as a structure, we'll do the presentation, but it won't be particularly formal. I'll ask questions and have to and fro throughout the conversation today. So pop your questions in as they come up.
Amazing. Oh, that's me. There we go. Okay, so a common thing that I think we hear within the workers' comp injury management landscape is realistically, people don't want to deal with this. They don't know what to do in terms of, how to first best respond to someone when they do get injured or are ill. And this is not only something that we see within the workers' comp and injury management space, but I think we see this across the people space. We don't necessarily know what to say if someone is grieving or they have a personal loss either. And it's really easy for us to just sort of retreat. And often in the workplace environment, we collectively retreat as well. So if one person sort of takes, a step back and doesn't sort of contribute or know what to do, that's quite contagious. And we find that generally happens sort of en masse, and that then creates a scenario where we have, that really kind of avoidant situation where we just don't know what to do, and we get stuck. So why does that happen? I think it's really important to understand what causes this, and why we're sort of seeing this. So these are the six sort of points that really, I guess, explain why avoidance and that disconnection often becomes something that is almost default to us. So we don't necessarily set out or intend to do that, but it becomes our default response because we don't know what to do. So
Carly,
instead
I'm
of,
really sorry. I think we've lost your slides.
have you,
That's all right. Unless it's just
have we
me.
got, have we got them now?
Uh, Not for me. Can everyone else see the slides? Apologies. Technical glitches.
Sorry, guys, this is my fault, technical issue.
No.
Let
What between
me stop, let's
Zoom
stop
and
sharing and go
Google?
back. Okay.
Oh, there you go. This looks promising.
It's loading, it's loading.
You're back.
All good?
That's it? Perfect.
Perfect. Okay, great. So the 6 points of why we take a step back, we become disconnected, and we keep doing that over and over. So the first one is really probably the most obvious, is that there's a real disconnect and discomfort with vulnerability. I think most workplaces really want to focus on things like productivity, control, resilience, which is absolutely normal and understandable. But when an injury happens, whether it's a physical injury or, a mental health or psychological injury, that interrupts that narrative that's normally going on. And it forces people to actually confront, some hard topics. And it brings up, I guess, that fragility that we have as humans. So sometimes that can be quite threatening to us, and we don't genuinely know what to say or what to do. And instead of sort of, pursuing that and thinking, well, maybe I should find out, it becomes unspoken, and that fear drives us to distance ourselves from someone, to kind of just, fade into the shadows a little bit, rather than coming out and saying, I don't know how to speak to you, I don't know what to ask, but I'm just letting you know I'm here, which could be something that would be completely acceptable to say. So fear is really the first one, and I think as humans, we don't want to be fearful, but that's sometimes our default. I think number two, the fear of saying the wrong thing. This is a massive one. People worry that if we acknowledge something, or we talk about someone's injury, or the trauma or the event or crisis they're going through, it's going to make it worse. It's simply not true. We've got so much data out there, and this, goes back to a lot of psychological study in terms of connecting with people, and that human interaction is absolutely the most important thing. It's not necessarily about what we're saying, it's just the fact that we're saying something and connecting. So there's no wrong thing as such. I think in a business context as well, we worry that, if we're going to say something, then it might get reported to HR, or it might become a legal issue or something worse than that. So instead of, not knowing what to say, we go, all right, we're not going to just say anything because we think we might say the wrong thing. And I think that's something that we learn, and that tone is generally set within organizations as well, where people, may not generally speak up, or they know that if they do potentially speak up, there may be consequences for that. So the fear of saying the wrong thing can really sort of trap people as well. Number three really ties into this too from an organizational perspective. So there's definitely sometimes an organizational culture of silence. And this works really well as a connection to that safety piece too. In, an organization may not want necessarily people to speak up and report hazards, or, those sorts of things as well. So, around here, we don't say that. That can sometimes be the kind of normal narrative as well. And we subtly actually reward that in some organizations too. So some leaders may actually model, a detachment, or, treat things as more of a logistical thing. So if someone gets hurt, oh, well, look, we record that in the system and we track that, and then that's that, rather than actually, treating it as a humane issue, and a something that we actually need to connect and talk about, and actually deal with. So potentially that could be one of the reasons as well. Productivity pressures, I think hands down, we can all relate to this. Businesses are operationally functional and they have to be able to make a profit to pay us to work for them. But at the same time, we're all aware of the fact that, time off, reduced workloads, people on suitable duties, different accommodations, they can be seen as a burden rather than an opportunity as well. So sometimes we look at those things and we feel the pressure of it and we think, oh, this is going to be too hard. I've got to just crack on. I'm too busy. I have to do this. I have to do that. That we naturally avoid and disconnect from reaching out when that scenario happens. A lack of training or leadership modeling, and I think I touched on this just a little bit before, what we see is generally what we do. As humans, we are creatures of habit, and when we're in environments where we're seeing certain behaviors modeled, we start to replicate that. As I said before, things become contagious in groups. So if we see that behavior that's modeled to us is that, we don't ask people how they are, we don't check in on people, we don't sort of, put a care program into what we're doing normally, we start to model that. And that becomes our default as well. And people don't know what they don't know. So unless there are programs or, frameworks or training and coaching and mentoring available to people, they don't know the impact or the damage that is potentially being caused by disconnecting as well. And then I think probably the last one, stigma and shame, again, something we probably can all relate to. I think for me, in something that I've actually noticed probably only in the last few years is the words compo is something I've always really not liked or resonated with. And I think that has started to shift a little bit, but there's always been a stigma or shame around people going on compo, right? So if you've got an injury, you might have heard those things before is, oh, he's injured, he's probably going to go on compo. It's seen as a negative connotation. There's stigma attached to it. There's shame attached to it. And that may be from both sides as well, from an employment side, but from an employee side. People often don't want to get hurt. They want to be at work. They want to keep to their routines. So hiding things potentially as well when things go wrong, we see that. And that's just I guess, another really key component, I guess, in why our default is to disconnect.
Carly, just on those six, that was super interesting. Because they affect both the injured person and the support staff there to help them.
100%. Yeah.
So how do those six play out differently for those two roles? Which ones do you think are kind of particularly important?
Yeah, look, I think in all honesty, there's going to be some that I think you will not, I would imagine you'll notify straight away. So you might be going, oh, in my organization or, for the insurer I work for or whatever it might be, you're probably going to go 2, 4, and 6, absolutely recognize them straight away. But I think in all honesty, you would see there's a connection between all of them. And that's the culture, right? So I think it really comes down to the undertone that culture of the organization you work for, the people you support, what you've been exposed to, all of those factors, they intrinsically link all of those. But you will see ones that have absolute, you go, number 2, that is my workplace, hands down. That's why we do what we do.
Awesome. Thank you.
No, so what happens when we have a culture of disconnect? What happens when we don't talk to people and we remain silent? So I think we all kind of know that from a cost, getting it wrong really sets us up to fail, quite simply. Evidence shows us that if we communicate, if we talk to people, if we show care, that we're actually able to get better health outcomes. And if we do the opposite applies. So not doing that, the silence, the disconnection, the lack of response, it shows in return to work rates. It shows in lost time. It shows in financial cost. So we see people returning maybe to the workplace for a small amount of time, potentially failing to stay in the workplace. We see people not coming back into the workplace. The whole cost of getting it wrong can be really catastrophic. And I'm going to touch on it a little bit later, how important that early intervention stage is and why it's absolutely critical. I put this in here, and I think this is a comment from a regulator, and it summarizes the issue really well. So employers are typically not great at staying in touch with their workers. We know this. This actually comes from a study that I'm going to refer to later. We know that when people get hurt or are injured or ill at work because of work, we're not good as employers at reaching out to them. And I think we can identify from the previous 6 points why, right? When we've got those things working against us or existing, that's why we can't do it. So it's a real missed opportunity. And I think the value of getting it right articulates why. So if we can change, and these are not huge changes, they're little measurable snippets of what we can immediately implement to demonstrate and show positive person-centric communication, we get the results time and time again. So early proactive contact, clear and kind communication, and genuine consultation. And what do I mean by genuine consultation? I mean actually genuinely engaging in the consultation. So rather than having something preset or determined, and I understand, especially insurers, self-insurers, employers, we're all very regulated in how we have to operate. We have to do things by the book. We have to stick to our policies and to the legislation. But there's nothing in the legislation that says that we shouldn't be clear, that we shouldn't be kind. So these are all things that we're, as organisations, choosing potentially not to do. So we can see immediately when we start doing them, we see reduced costs, which organisations love, which insurers love. Our metrics improve. And you know what? Forget all of that. Our team members feel seen, they feel supported, and they feel safe. So I've got some really hot tips for you in terms of how do we achieve what I'm talking about? How do we actually break this cycle of doing what we've always done because we've always done it? And when I say these to you, you're probably going to look at them and go, they're not really that hot, in terms of their tips, but they are. And they're so easy to implement. So the first one here, we said going silent or going legal too quickly. Something very common and probably people can relate to straight away. Okay, make early, compassionate human contact. How are you feeling? That should come before any type of conversation about the claim, about the process, about any policy, from both sides, from all sides. Having a conversation with someone just to genuinely ask them how they are is absolutely critical. And workers respond to it every single time. Focusing solely on process, not the person. Okay, so we know we've got a job to do, we have metrics to meet, but the best way to achieve those is to actually focus on the person. Ask what the person needs, offer support, offer both emotional things in terms of, just your time and connection, which is one, and offer practical guidance. Not having all of the answers straight away is absolutely fine as well. So that's a human connection that you have with them. Saying to someone, I don't know, but I'm going to find out for you, or I'm going to try and assist you, is so meaningful and so impactful as well. The third one, assuming the injury is just physical. Again, I think we probably all know that, when we're dealing with a physical injury, that's one part of it, but it's usually only a small percentage. So those biopsychosocial triggers that come into an injury once someone has been hurt are really important. So you need to actually give time and have time and empathy and be available to talk to people about their emotional and mental well-being. Offering EAP support or whatever support you might be able to assist with. It sounds cliche, but it is something that is underutilized across every single industry, and every EAP provider will tell you that, right? It is there. Businesses pay a lot of money for it, and it is absolutely untapped and unutilized as a resource. Get people to be using it, be an advocate for it, download the app that company might use, be familiar with how to access it. So you can actually talk someone through it and say, I know how to access it. I can sit with you for 2 minutes and take you through it. And it's really simple. And if you've got any concerns, I can help you. So put yourself in their shoes and be available to talk about those things with people. Delaying contact or return to work planning. This can be really damaging to our team members. So if we delay things, it gets harder. We all know that. So if you put something off the next day, I'll do it tomorrow. Next day, I'll do it tomorrow. You don't do it. It becomes hard to the point where so much time has passed that it's just too hard. And you think, that happened a long time ago. I might not even bother about that anymore. Great example and anecdote for something that happens in the safety world too. You see a hazard. You think, oh, John's probably reported that. I won't bother reporting that. You see it again the next day. That's still there. What should I? It'll be fine. It's 2 weeks later. It's still there, but I haven't reported it now. And, it'll get fixed. The next day, someone falls, hurts themselves, whatever happens. It's never too late. So if you do have those points of connection that you need to jump in and really reestablish, do it. It's never a missed opportunity to jump in and then have that connection. First few days, make it really simple. Make it low pressure. See how they're doing. What do they need? How can I support? What do you think recovery looks like? This next one, I think we've seen this: blaming, minimizing, or second guessing the injury. It is never our job to do that. We are here to support the injury, not the legitimacy of it, and talk about, those components of what may or may not be true. Now, definitely understand there's legislative requirements in terms of investigating and making sure that, liability can be established and accepted. That's absolutely fine. But always go into a conversation and to a connection with an assumption of good faith. Assume good intent. Most people, 99.9% of people, are wanting to do the right thing. Be transparent. So if you have to investigate or conduct inquiries, let people know. It's very appropriate to say to someone, I'm here to support you and I'm going to help you, and what do you need? But I am letting you know that we do have to carry out a normal investigative process that's part of, the requirement of my role or the requirement of the organization. So go in with curiosity and empathy, not suspicion. Failing to communicate internally. I think this is a big one, especially in employer land. Make sure that you do give people information and give them an opportunity to stay connected. And I think people like that too. They want to know that their workmates and their colleagues and their supervisor and whoever else are thinking of them. So make sure that you do communicate and you keep people up to date with what's happening internally within an environment. Over-promising and under-informing. This is a big one that I think comes out a lot too. Be honest. If you don't know something, say, I don't know. If you don't know what you're doing, make sure that you're actually letting that person know that you're going to try and facilitate that for them. Don't promise that you're an expert. We'll take care of it. It's all good. Don't worry about it if that's not what the scenario is going to be. So make sure that you are very articulate and you set reasonable expectations. People like expectations and they know what to expect. Failing to document early. This is a big one. A very real example I'll quickly give you about this is recently, and I'm going to say in the last 6 months, I decided that the way that I was going to start file noting was not going to be for compliance purposes. It was going to do that and it was going to achieve that goal, but I was going to do it to actually track progress and to develop strategy. And the mindset of doing that absolutely changed how I did file noting. For me, I stopped seeing it as a really onerous, admin task that, just got to put this in here. So if I get audited, I'm covered. It became something that I would work on to actually strategically work out what I was going to do and plan the best possible outcome that I could for that case I was working on. Now, be smart. Use everything you can in your toolkit. If you can use, AI tools, if you can use voice recording, use it. Make it simple and make it smart, but start documenting supportively. And forgetting the role of supervisors. I think we probably all know this. The role of the supervisor is so important. Our team members see their leader or their supervisor as a representation of the company. It's so important to make sure that we're getting these guys on board to be able to support us, to support our team members, training, guidance, trauma-informed communication. What's a return to work plan? Just the little things. Never assume that they know. Support them, guide them, help them, assist them. So they're my top 9 tips for connection in the workplace.
Karli, I love that. Can I jump in with the question we got?
Go for it.
So
Yes.
some of these, this feels like a combination of policy and also kind of model behavior. So the question is, how do leaders set the tone for those
Love this
behaviors?
question.
Yeah, so there's obviously don't do this, lead with this type of approach. And when you talked about EAP, it reminded me of my boss, a previous company, who talked about how he used EAP to get through just like a rough patch he was having with his family, and therefore kind of made it, normalized it, and made it appropriate for us to feel like we could use it. So yeah, what's the role of leaders in changing those behaviors?
Oh, absolutely. Great question. And critical is the role. And I'll tell you why it's critical. I think we all know, right? The tone is driven from the top in any organization, right? What's important to our boss becomes important to us. The biggest thing that a leader can do to influence or impact is to be visible. So I think visible leadership is really, really important. And visibility is not just, turning up and being there, but that is actually a huge part of it, right? So in terms of engagement, and I think, Hadley, you said it before, getting a leader to actually be an advocate or using a personalized example. And that might not be all of your leaders, but I bet you there is someone that you could identify who's a leader in your organization or business that you could get on board to come and be your sponsor or your champion of what you think great leadership and leadership modeling is. Use that person, get someone with a human touch. Everyone knows someone who's been affected by a trauma, a crisis, something that's, gone wrong in their life, right? It's about finding someone that you can connect with from a leadership perspective as well to actually help you get other leaders on board. And I guess what I'm going to say now might be a little bit controversial. And I think it's, I've worked in organizations where it's not driven down from the top. We've had to try and push it up. And that's not ideal, but it's not impossible either. So even if you don't have modeled leadership, that doesn't mean that you can't change what you do, and it doesn't mean that you can't influence. Never underestimate your ability to influence. So when, as I said before, you start to model your own behavior, you start to do things, you start to change, you start to put in questions. How are you? I'm checking in. I'm normalizing this behavior. It becomes contagious. So don't ever underestimate your ability to influence.
So even if you don't have leadership that's bought in, you're saying modeling it yourself, agreeing what you want to do, and then it becomes an infectious or contagious behavior. You can start pushing up.
100%. And I think if we looked at any kind of leadership kind of triangle, we could see that, the ideal is to have things cascaded down. And, we have leaders who come out and they demonstrate and they're visible and they're out there and they're, setting accountability and the tone. That's not always reality. It's not, and I think, people push back on that, even myself. I think, oh, why aren't they on board? Why don't they get this? I can make a choice. I can go, oh, well, they're not on board. I'm not on board. Again, they're modeling that behavior. I'm being conditioned to it and I'm exhibiting that. Or I go, you know what? I know how important this is and I know that I can get results and I know that I can demonstrate these results. So I'm going to set the tone and I'm going to model up.
Good stuff. Right. So over back to you.
No, all good. Early intervention. So what does that mean? Early intervention is the first, I think technically, according to the Monash study, it's the first 4 weeks after an injury happens. For me, early intervention is smaller. So the first days are critical after an injury happens. And I think we probably already, are aware of this in terms of when someone gets injured, the quicker we can make a connection, the quicker we can touch base with them, the more supported they feel. And again, that shortens that gap or that hesitation of us going, oh, it's been too long now, I better not contact them, or, oh, I'll wait another day, right? So the first few days. And as we said before, low touch point. It doesn't have to be a whole essay, a whole 2 hour conversation. It can just be, I'm calling because you got hurt and I want to see if you're okay. Yes, there's a process. Yes, there's policies. Yes, there's protocol. And we'll get to that and I'll support you. And I'm going to show you how to do that because as a subject matter expert, that's my job. But the first low pressure touch points are really critical. And how we respond, it lays the groundwork, as I said here, for trust recovery and return, or it creates lasting harm and prolonged absence. Person-centered care, simple shifts. So these are really easy little things that we can do. And we've covered them as we've been speaking. Lead with humanity, not a policy. So, if you're making a call, don't call someone and say, hi, it's Karli here. I'm just calling to talk you through the injury management policy we have because I noticed you've got hurt. Or I'm going to talk you through the claims process because it's come through my desk because you've been hurt. Lead with humanity. Hi, it's Karli here. Unfortunately, I've seen that you've been hurt. Are you okay? Is there anything you need? So simple. Normalize the experience of injury. So when people get hurt, don't make them feel like they've done something wrong. They're the odd one out. Oh, I've never seen anyone get hurt on that piece of equipment before. You must have been doing the wrong thing. Normalize it. Unfortunately, people get hurt, but we've got some great processes and I'm here to support you. So we're going to get through this together. Normalize the experience. Ask, don't assume. Never assume anything. If you don't know something, ask them. I can see here that you've been hurt and I'm so sorry, but I can't. Can you explain it to me? Because I want to make sure this never happens to someone else. Don't assume, oh, he must have been doing the wrong thing. That's why that happened. Be curious. Don't be judgmental. Be transparent about the process. Don't hide behind it. We have rules to follow. We have KPIs. We have goals. If someone says to you, oh, you're just doing that because you've got a metric to meet, be honest and say, we absolutely do have metrics and we have them in place because we want to provide the best possible experience to our team members. And we know that by doing the right thing helps us to help you and it helps us. So be really transparent about the process. Don't say, I can't do that. Well, that's the legislation. Sorry. Acknowledge power imbalances. So injured workers often say as a really normal thing that they feel they have no power. Acknowledge that if someone says that to you. And don't lie about it because we understand that potentially a CEO in a business, an operations manager, a leader probably does have more power than an injured worker who may be, just a functional operational employee of a business. Acknowledge that, but do your best to actually help and assist that person regardless of them and give them back their power. Keep comms warm and ongoing. Don't call someone once. There's no point. Put it in your calendar. Commit to it. Schedule it. Be efficient. People love contact. Make support visible. So if you say you're going to do something, do it. Actually walk the talk. Super important. Again, don't under deliver if you've promised. So traditional versus centered return to work. Again, things to avoid. You're still off work. What possible impact can that question have to someone ever? Right? So it implies a judgment or disbelief. And if you think about what you're going to say, and if you remove judgment from anything you're going to communicate, it becomes really easy because you actually genuinely start going, I wonder what is going on with this person. I don't know. I'm not assuming. So I'm going to ask. I'm going to ask normal questions that show human connection and interest. Oh, we really need you back at work soon. We're really busy. We're 2 men down. Pressure. People don't want to feel pressure. Reframe. We really miss you at work. Barry's asking about you. John's asking about you. We miss you as a team member and we just want to get you back. Same question. Completely different intent and delivery. Oh, I've got lots of paperwork. Let's just get through this quickly. I mean, I don't think I even need to explain that, right? It prioritizes your process over the care, right? So if you have something to get through and it's going to take some time, make sure you set the time and you set the expectation. This is going to take probably 10 to 15 minutes. Have you got time to do that now? If you don't, we can come back. Oh, that's not my job. That's above my pay grade. I think we've all heard that. We hear that all the time. It signals a disconnection straight away, right? Instead of saying that, oh, great question. Off the top of my head, I don't know, but I do know who I can ask and I can come straight back to you. Same thing. Person-centered care. Ask about the person. Keep it centered around the person. Be flexible. Don't be rigid. Listen to what people are saying to you. Don't listen to respond. Listen to understand. And sometimes the most powerful changes like this does not require, we don't need money to do this. We don't need a better system. We don't need a complex procedure. It's just about experience in terms of communication and a consistent presence when we're looking at these sorts of things. One question can change the trajectory of a claim or an injury in so many ways. So keep things person-centered.
Karli, I'm just going to jump in. Sorry. A lot of this sounds like just simple authenticity and empathy. Like just be yourself, be
Be
interested in the other
yourself.
person. How do you get people to that place? Or is it training? Is it like role modeling, like you said earlier? How do
It's, yeah,
you like almost giving permission to just be a human being?
100%, that's it. And with that comes the reverse too, Hadley. So acknowledging, and I acknowledge this absolutely openly, this is a tough gig. Working in injury management and workers' comp is tough. And we get sick of listening to people and their stories. And that's normal too, right? That's human. If we didn't become fatigued from listening to these stories, then we wouldn't be human, we'd be robots. So absolutely creating empathy. I mean, if I could tell you how to create empathy, then I would be, a very, very wealthy person.
Fair
Um,
play.
but all of these things are, training, reading. There's so much research and literature, which is a great segue. People have done the research. We don't need to go out and do it, right? People know what works. There are frameworks, there are documents, there are programs that exist and are free to all of us that we can go and upskill ourselves and make ourselves more aware. And I think it's being curious is really central to that, right? Always being curious rather than being judgmental. That's the key for empathy. So I think take whatever time you can to research, upskill, and then you become passionate like I am about it, that you start talking about it with other people and then they start going, oh, what's that about? So it's that contagious thing, and that's how you change and build culture. So these are the light reading that we have. 4 documents that I think are absolutely brilliant, already out there. Extensive research has been done. They exist and hardly anyone knows about them within this remit. So the Behaviour Change Collaborative, this is a study that was done that actually tells you how to talk to workers based on what they want said to them and how they want it said. It talks about tone. It talks about all of those things. This is a whole document that talks about that. Have a look at it. It's amazing. It's readily available online. It Pays to Care, if anyone's heard of that program, another brilliant program, evidence-informed practice that tells us how to treat workers from all stakeholders, medical stakeholders, employers, insurers. It talks about exactly how to implement what I've been talking about, and it pays to care. It's in the name, right? It talks about the monetary efficiencies of doing these practices and doing the work. Early intervention in the workers' comp process, another great document as well. And then probably the last one, that's actually a Safe Work Australia document that's come out probably 2023, yeah, so 2 years ago now. It is a framework that is actually a communication guideline of how to talk to people about workers' compensation. Jump on, look at them. They're amazing documents, they're free, and they tell us exactly the evidence and the research behind this. Great for trying to get buy-in from an upper level as well, when you can present evidence and research too. So, key takeaways. There's some little tips there. One key thing, if I can say to you, is care is not an optional extra when we're doing this work. It's not something that we tack on. It's not the warm and fluffy. It's actually the heart of the work. So when we think about care, don't think about it as doing the job with care. It's not a detour from the work. It's actually how we do work and how we do good work. And when you start to change that mindset, it's actually really liberating. Checking in's not a waste of time, ever, ever, from anyone. Saying something is harmful, or something is hurtful, or something causes pain, or acknowledging negative things is okay, and it is human, and it is real, and it shows that you are a genuine, authentic person. Rest is not a weakness either. If people need to take time, they need to take time, and I would apply that to yourselves as well. Making time for someone who's hurting, it's not an extra nice to have. It is the work. And last but not least, my final takeaway, the way that we respond to injury is the culture. It's not the poster we put up. It's not the fancy system we bring in. It's none of that. It's what happens when someone's hurt, something's uncertain, or they're not at their best. That is our real culture. The first few days are so important. So make sure you make it count. And think about how you would feel if you're in that scenario. I think it's always great to put yourself back in a scenario when you're communicating with people. The old adage, treat people how you'd like to be treated. Really important.
Karli, I love that. And I think we've probably just got time for one question before time's up.
Sorry, guys. Yeah.
No, no, it's fine. We ask questions throughout. I just liked this one. This is about burnout. So you're asking people to change behavior when they're already quite stretched, having to do a lot. So how do you address that? So how do you kind of balance the limits of people's existing workloads with now asking them to be more empathic, be more present, to kind of to think differently about how they engage with injured workers and return to work?
Of course. Great question. Reframe it a little bit though, in that don't change anything you need to do in terms of adding on, just change the way you're doing it. So one thing that I changed, I reckon probably 6 months ago, to be honest, when I say to someone, and I don't deal with injured workers every day, but I mentor and coach people who do, and I talk to insurers frequently. One thing that I have changed is my language, and I do this every time I talk about an injury. I don't say return to work anymore. I say return to life. And the impact that makes, that doesn't cost me anything. It doesn't take any more of my time. It's not an add-on. It's just a simple change. The impact that has is astronomical. And I've had feedback. I've had, people say to me, what do you mean, life? And I say, well, when you get hurt in the workplace, you don't go home and take the cast off your arm and it's fine. You're still wearing that cast at home, right? You still can't pick up your kid. You still can't go to cricket. You still can't go out on the weekend and have a few drinks because you're taking really heavy antibiotics, whatever it might be, right? It's not about returning to work. It's about returning to life, and work is a component of that. When we focus solely on the work, we take the humane side out of it. Now, obviously, we work for the employer and we want them back at work, but we want them back at life because that's when they're best at work. Little changes. Even if you adapt that, see how it goes for 3 months, change that.
I love that. Karli, thank you. I think that's a great place to end. Yeah, you're right. It's not return to work, it's return to life. And I think that injecting that little bit of humanity can make a big difference for everyone. So thank you all for your time. Karli, thank you in particular for making time to talk to us
Thanks, everyone.
today. It's been great. And I'll send out the link to the recording afterwards. And thank you all. Have a good day.
Thank you so much.
Bye-bye.